Hi, welcome to the Warwick Medical School GALS exams. There may be variations at your local institution, so please follow your local advice. Here's the GALS exam.
Hello, my name's Dr. Gill. I've been asked to do a GALS examination on you, so that's going to look at your gait, arms, legs and spine. Before I start, could I please confirm your name and date of birth?
It's Ross Cooper, 2nd of August 94.
Super, thank you. So to start off, we need to do 3 questions. Have you noticed any pains to your muscles, joints or back?
No.
Okay. Do you have any difficulty getting up and down stairs?
No.
Okay. And do you have any problems dressing yourself in the morning?
No.
So on that, you haven't said yes to any of our questions, so ordinarily we wouldn't carry on. However, we will carry on in this instance for the examination. So with that in mind, if I can get you to take your shirt off, please. And if I can get you to climb down from the bed, please, and walk 5 steps, turn and come back. So as observing the gait, I can't see any evidence of Trendelenburg gait, there's no signs of a foot drop, and there's not any evidence of an antalgic gait either. Super. So if you just stand that way for me. So having a look at the back to start off with, I'm looking at alignment. You've got a good alignment to the shoulder. I can't see any evidence with scoliosis at the back. There's no obvious issues to the back of the knees with hyperextension, and I can't see any signs of issues with the heels in terms of supination. If you could turn to face this way for me, and if you could turn to face forwards for me. And again, checking over the muscle bulks, I can't see any signs of wasting, and there's no obvious scars nor abnormalities there. Fantastic. So to start off, we're going to have a look at your spine. So if I can get you to put your chin on your chest for me, and then all the way back, and back to centre. Any problems with that?
No.
Super. If I can get you to turn all the way to the right for me, and then all the way to the left, and back to centre. Any problems with that?
No.
And if you could put your one ear to one shoulder, and then the opposite side. Super. Any problems with that?
No.
Good. And if you could try and reach down to one knee for me. Brilliant. And then to the other side. Fantastic. Okay, any problems with that?
No.
If I can get you to turn around, and in a moment you're going to try and bend over and touch the floor. I'm going to put my fingers on your back. So find the dimples of Venus, and if you could bend forward to touch your toes, and we've got an excellent range of movement, and coming all the way back for me. Superb, thank you. So if you could sit on the bed for me, and if you cross your arms over your chest, and now I'm going to get you to turn to the left, and if you could stand here for me, and turn to face me. So having a look from the front, I can't see any obvious issues with the shoulders. We've got good muscle bulk, and our feet and knees seem in alignment. If you could turn to face that way for me. Having a look to the side, confirming that there's no problems with the cervical lordosis, the thoracic kyphosis and the lumbar lordosis all look good. I can't see any problems with hyperextension or fixed flexion deformity of the elbows. Just checking on the other side, that's fine. And then looking at the calves, I can't see any evidence of muscle wasting, and paying close attention to the popliteal fossas, I can't see any evidence of a Baker's cyst on either side. And there's no issues with high or low arches on the feet. And if you could turn to face the wall for me. Having a look again at the back, I can't see any signs of scoliosis. There's no obvious scars either. If I could get you to turn to face me, please. So we're going to do some movement of the spine. So starting off at the top, moving down. So if I can get you to put your chin on your chest for me, and then all the way back, and back to centre. Any problems with that?
No.
Super. If I can get you to turn all the way to the right for me, and then all the way to the left, and back to centre. Any problems with that?
No.
And if you could put your one ear to one shoulder, and then the opposite side. Super. Any problems with that?
No.
Good. And if you could try and reach down to one knee for me. Brilliant. And then to the other side. Fantastic. Okay, any problems with that?
No.
If I can get you to turn around, and in a moment you're going to try and bend over and touch the floor. I'm going to put my fingers on your back. So at the lumbar spine, I'm just going to put my fingers on your skin by the dimples of Venus, and if you bend all the way forwards for me, so we've got Excellent extension, and then come backwards for me. And all that, that's fine. So we've got an excellent range of movement. If I could get you to sit on the couch for me. Okay, so if we can get you to put your hands up behind your head for me. So I'm looking at the abduction of the shoulder, I'm looking at the external rotation of the shoulder and the elbow flexion at the same time. And I can see the elbows are nicely aligned. There's no issues with the shoulders. So that's fantastic. And if you could make a prayer sign for me. Okay, so we've got excellent flexion at the wrists, and if you put your hands all the way out in front. So having a look over the dorsum of the hands, I can't see any swelling to the MCPs. There's no obvious joint issues to the PIP or DIPs. I'm just going to squeeze over your knuckles. Any pain when I do that?
No.
There's no clear scars nor muscle wasting. If you could make a fist for me. And we've got good guttering across the knuckles. If you could turn your hands over for me. Looking over the palms of the hands, there's no obvious muscle wasting. There's no palmar erythema. And again, if you could make a fist for me. And relax. Okay, fantastic, thank you. And squeeze my fingers tight as you can. Try and break it. Really go for it. And relax for me. And just with your thumb and index finger, squeeze my fingers. And relax for me. And then if you could put your thumb to your index, middle, ring and little finger. Super, so we've got no problems there. I'm going to get you to lie back on the bed for me, and we're going to have a look at your legs. So we're just going to have a look at the legs. As an overview, I can't see any evidence of deformities, there's no obvious scars, and I can't see any wasting of the muscles. So I'm just going to move your hips now and see how far we can go. So lifting the hip up, bending the knee, and going external and internal rotation. Coming down again, bringing up the knee and the hip, doing external and internal rotation. That's good. Now we're going to have a look at your movement of your knees. So if you take your heel up to your bottom for me, and then back down, and the same again on the opposite side, and back down, thank you. I'm just going to do the same now, but I'm going to put my hand over your knee, feeling for any bumps, cracks, anything like that. That's all good. I'll do the same again on the opposite side. So we couldn't see any obvious swellings or redness to the knees. Just going to check the temperature. That's fine. And I'm going to double check there's no evidence of a patella tap, so sweeping down and pushing up and checking to see if there's any tap. We've got no issues there. I'm going to do the same again on the opposite side. So again, we're sweeping down, pressing up and tapping with the thumb. And there's no fluid effusion there. There's no positive tap. That's good. Having a look over the feet, I can't see any signs of calluses, there's no bunions, there's no obvious deformity to the arches. So I'm just going to squeeze over the tops of the toes. Any pain or tenderness there?
No.
Super. So you can sit up for me. So that completes our examination. We've got a normal GALS screen. Do you have any questions for me?
No.
Super. I'll kick your shirt. Thank you.